Hi everyone, and welcome to part 1, Introduction to Basic Life Support. Now in the upcoming video series, we're going to be covering all of these topics you see here. But today we're going to focus on the key points of performing basic life support, which is important because the science suggests we do this for our patient, and two, you may be seeing this information on a test in your immediate future. So let's get started. First, quality chest compressions. Now, when performing chest compressions on the adult, the compression depth is important. The literature states at least 2 inches in the adult, not to exceed 2.4 inches. Compression rate. The new 2015 guideline specifies chest compressions should be performed between 100 and 120 compressions per minute. Remember, it's important to allow for complete chest recoil. And we see this all the time, especially in the adult. We're leaning over the body, we're pressing down, and we're not allowing that chest to completely recoil. That is imperative. Again, at least 2 inches, not to exceed 2.4, but we have to let that chest completely recoil before we apply the next compression. The new guidelines also de-emphasize checking for a pulse. And when we do check for a pulse, no more than 10 seconds. That's it. Next, minimize chest compression interruption. And this is what they're talking about when you hear compression fraction. Compression fraction is the time that we spend actually compressing on the chest. And that should be at least minimally 60% of the time. So within 1 minute, 60% of that 1 minute at least should be spent actively compressing, actively doing chest compressions. Effective breathing for the patient. Effective bag valve mask ventilation. What's important to note here, don't overbag the patient. Excessive breaths. Excessive tidal volumes can actually increase intrathoracic pressure and reduce blood return to the heart. If you're bagging too fast, too aggressively with too much tidal volume, more air can go into the belly. This can lead to vomiting, aspiration, and we've gone from the frying pan into the fire. So watch your bagging. Our goal is to see chest rise. That's it. We just want to see that chest come up and down when we apply a positive pressure ventilation. Next, the chain of survival. And honestly, if more Americans just knew this, we would save more lives. So let's look at the adult chain of survival. First, establish unresponsiveness. Poke your victim with a stick, a sternal rub. They're unresponsive. Next, activate EMS. Get some help coming. You're going to need help and you're going to need a defibrillator. Now, if you're alone, one rescuer, just yourself, if you have a cell phone, pull it out, call 911, put it on speaker, and go to work. If you don't have a cell phone, you're going to have to leave the victim and call 911. If you know where a defibrillator is, if you know where that AED is, go grab it and bring it back to the patient. Now, if there's 2 rescuers, one is going to go for help in an AED, the other one is going to stay and immediately begin chest compressions. Which leads us to the next step in the chain of survival, CAB. Compressions, airway, breathing. Start the resuscitation. Begin chest compressions. Now, as soon as an AED becomes available, apply it to the patient, and if they need to be shocked, deliver the shock. Next in the chain of survival, early access to advanced cardiac life support. And this is 911 showing up at the scene. And it's important that we get help here quickly to that victim. That's why we call so early in the algorithm. In the chain of survival, the second step is call for help. Last step in the chain of survival, post-cardiac arrest care. This is making sure we're taking the patient to a facility that can manage a cardiac arrest and manage this patient after the cardiac arrest. Next, let's take a quick look at the pediatric chain of survival. And this all starts with prevention, not letting the child arrest in the first place. Child-proofing the home, car seats, immunizations, all these things help minimize the risk of a child getting into trouble, having a cardiac arrest. Next, the emphasis, quality chest compressions, quality ventilations. Remember, when we're compressing the chest of a child or an infant, the depth, the amount that we're going to compress is about 1/3 the distance anterior to posterior. Next, get help coming. Call 911. Get professional help coming quick. Next, post-resuscitation care. we need to make certain that this pediatric patient goes to a facility that knows how to manage a post-cardiac arrest pediatric patient. Next, is this patient an overdose? Have they suffered from a heroin or an opioid overdose? We need to assess for that quickly. Remember, these drugs are potent respiratory depressants. The patient stops breathing, then subsequently cardiac arrest. So we need to assess for this overdose quickly and apply the antidote, Narcan, Naloxone, if we have it. Now, a few things that healthcare providers specifically should be aware of. One, they no longer recommend the routine use of cricoid pressure during positive pressure ventilation. Whenever possible, if you have to defibrillate a child, use pediatric pads with a pediatric attenuator. Now, if you don't have that, you don't have a manual defibrillator, if all you have is an adult AED to use on this pediatric patient, then use that. This has been part 1, Introduction to Basic Life Support. Thank you for watching. My name is Mark, and I will see you in the next video.